on COVID-19 responses in Africa is underway. Let's take you there.
Last second, a cumulative total of 8.6 million people have been reportedly infected with COVID-19 on the continent. Of that number, unfortunately, 223,000 people have died across the continent. And over the last couple of weeks, the 5 most populous countries in Africa that account for at least 61% of all caseloads include South Africa with 34%, Morocco 11%, Tunisia 8%, Libya 4%, and Ethiopia 4%. When you look at the numbers of countries that are going through the third wave, the fourth and fifth wave, the numbers have not changed significantly. We still have 46 countries that have gone through the third wave. 11 countries, as I stated last week, are currently going through the fourth wave. But importantly, Mauritius is now going through the fifth wave. So that is the only change from last week. However, it is important to notice that the situation with the variant is changing very quickly. 45 countries have reported the Alpha variant. 41 countries have reported the Beta variant. 44 countries have reported the Delta variant, with Djibouti now reporting that variant, which is the newest addition to the list of countries. 2 member states are reporting the Gamma variant, and 4 countries are now in Africa are now reporting the Omicron variant. And we all know this variant was initially picked up by the good surveillance systems that the government of South Africa and the scientists have put in place. And the countries include South Africa, Botswana, Nigeria, and Ghana. And on this note, I really want to join others in recognizing and congratulating South Africa, the leadership for being very transparent and timely so, and the scientists for the extraordinary work that they've done in picking up this variant. And not just this variant, but we also recall that the Beta variant was initially picked up due to the extensive state-of-the-art surveillance work that goes on in South Africa in terms of pathogen genomics. When we look at the trends, if you compare last week and this week, we observed a total number of 52,300 new cases. 52,300 new cases, and that represents a 105% increase in the number of new cases compared to last week. And we'll explain why this rapid increase there. If you look at that curves, we've been going down very nicely. That is bending the daily, 7 days daily moving average very nicely. But there's a little bit of ticking up in South Africa, and mainly attributed to this variant. And that is why you see this sharp increase there. So if you now look at different countries with reporting the highest number of new cases, we have South Africa with 31,000 cases. Remember, out of the 52,000 new cases, 31,000 are coming from South Africa, Egypt with 6,000, Libya 3,800, Mauritius 1,200, and Algeria 1,200. So that explains that 105% increase there that I just mentioned in terms of new cases. So it's skewed towards the situation in South Africa, which is driven now beginning to be driven mainly by the Omicron variant. So if we now look at the new deaths, as of last week to today, a total of 938 new deaths have occurred. And that represents 8% average decrease in the number of new deaths. If we now look at the last 4 weeks, then that is specifically the period between the 1st and the 28th of November, we notice a 20% average increase. Remember that ticking up is contributing to this, now contributing to this increase, where we have enjoyed a downward trend all the time. And the distribution looks as follows: a 153% increase in Southern Africa, 34% decrease in Central Africa, 19% average decrease in Western Africa, 7% average decrease in East Africa, and 1% average decrease in Northern Africa. If you look at the following breakdown by the most populous countries, we have South Africa with 196% average increase, DR Congo with 45% average increase, Ethiopia with 25%, 22% average decrease, Nigeria 19% average decrease, Kenya 14% average decrease, and Egypt 0.3% average decrease. In terms of new deaths over the last 4 weeks, we observed a 9% average decrease over that same time period. Our testing situation continues to be stable with a cumulative number of 82 million tests conducted since the start of this pandemic. Just last week alone, about 1 million new tests were conducted, and that represents a 26% average increase. In terms of vaccines and vaccinations, a total of, as of today, a total of 417.5 million COVID-19 doses have been procured by 54 member states in Africa. And of that number, a total of 235.8 million doses have been administered. The total coverage, that is the number of people that have been fully vaccinated, has edged up slightly to 7% on the population, with Morocco leading the charge with a total of over 60% vaccinated, Egypt 14% fully vaccinated, South Africa 34%, Algeria 11%, Mozambique 8.9%. Now, this is the percentage of population fully vaccinated. If you stratify this by the eligible population, that is the adult population vaccinated, some of these numbers are significantly higher. Like South Africa will probably be around 35% to 40% of the eligible population vaccinated. Harvard, the African Vaccine Acquisition Task Team, has distributed a total of 22.4 million doses of vaccines as of last week. Just last week alone, that is from the 25th of November to the 1st of December, 3.2 million doses of the J&J vaccines were distributed to 7 African member states, and they include Mozambique, Burkina Faso, Rwanda, Egypt, Gabon, Congo Republic, and Ethiopia. Now, the good news this week is that we all read the big story that the Aspen group in South Africa will be having a license to produce the Johnson & Johnson vaccines locally. That will be a license production, not contraction, which was remarkable news that we need to celebrate. We are beginning to see good progress in terms of manufacturing of vaccines on the continent. We need to celebrate that. Let me just end by saying that on Monday and Tuesday of next week, we will be hosting a meeting, a very important meeting in Kigali, where we will be at the head of state level, where we will be discussing pathways for the continent to issue emergency use authorization for vaccines as they come online. I just talked about South Africa. We hope that in the coming months, you get other countries like Rwanda, Senegal, and others begin to produce vaccines, and that will require that the continent develops a mechanism for approving the vaccines through the AMA, the African Medicine Agency. Thank you so much for your attention, and I look forward to your questions.
Thank you very much. That was Dr. John Nkengasong, the Africa CDC Director. We now move straight into your questions, and I can see that there are a few hands that have gone up. So let us start by saying good morning to Gabrielle Steinhauser, who is with the Wall Street Journal. Gabrielle, please, good morning, and go ahead.
Good morning. Thank you so much. how concerned are you about the COVID situation in Southern Africa and South Africa specifically, given that, at least in South Africa, we've seen this huge jump of cases with the new variant just over the last week or so? Is the Africa CDC doing anything to help countries prepare as their public health systems might come under pressure? And are you concerned that the travel bans will lead to shortages of some of the equipments and other, other things that countries need to deal with this huge surge in cases? Thank you.
No, thank you. We are definitely very concerned with the situation in Southern Africa and South Africa in particular. You saw the numbers that I just discussed with you. But we are not worried that the situation cannot be managed. Remember, this will be the fourth wave that we are going through the continent. So we've become at least more prepared to deal with these waves that come in and go. I mean, remember, this was the situation just in August, where we are dealing with a very brutal and aggressive third wave. So we know how to deploy rapid responders. We know how to deploy commodities. We know how to provide the interventions that are necessary. But we have been preparing for this for the longest, which is, remember, our message has been that as we were at the trough of this pandemic, which is the lower end of the transmission, what I call the low transmission season, that was the period to increase vaccination. And we have been saying this for the longest, that I was absolutely clear that just the other week or the few weeks ago that we will be facing another wave. What is worrying, however, is that we are moving towards the end of the year holiday seasons. And my concern and worry is that as people move around more, there's a greater risk that there will be these infections will continue to increase. And we expect to see really an outburst towards the end of December and January time period because of the holiday seasons there. So I think Africa CDC knows what to do. We've been dealing with this during the third wave, which was very, very aggressive. In multiple countries, we deployed swab teams across supply materials and to many, many countries. And we were preparing for this just as we did for the last wave. And I don't recall your last question. What was it again? About the supplies. I believe that hopefully, as we know more about this variant, that the bans on the flights to Southern African countries will be lifted. And as the variant spreads across the world, I think there are about 23 countries now that have reported this variant. I also interpret the bans that they were just early measures taken to blunt the spread of the variant. It's very difficult to stop these variants from spreading once they're out there. But it is my hope and wish that these bans should be lifted quickly so that South Africa will continue to get the supplies that they need.
All right. Thank you very much, John. Let's move on now to Paul Adepoju. Hello, Paul. Please go ahead with your question.
Yeah, thank you very much. So, Dr. John, I have three questions for you. The first question has to do with the Omicron variant itself. And when you look at the conversations around travel restrictions not working, the response from experts that I've been talking to regarding this is that travel restrictions actually allows countries to better prepare and slow down the spread of the variant among their populations. And we've also been seeing some African countries giving suggestions that this could actually happen. So I would like a comment on that. And in addition to that, we are also seeing conversations around some African countries putting the blame on richer countries not releasing doses. But we also see cases where millions of doses have been made made available to some African countries, but these have not been quickly rolled out as quickly as this would be. So I would like your response on that. If anything can change to quickly accelerate the rollout of available doses for Africa. And the last question, which is really, really important, is the situation in Nigeria. Prior to the Omicron, previous variants in Nigeria were reported by the Professor Api-led laboratory. But we now see the NCDC now actually be the one also carrying out sequencing. So I'd like to know if this is part of the structuring, how effective you think a regulator doing the sequencing on its own instead of maximizing the available networks of sequencing capabilities that the country currently has. Thank you very much.
Thank you, Paul. The Omicron variant, as you rightly said, when countries react to, so let me step back and say this, that we knew, and everybody knows, that travel restrictions have never stopped these variants from spreading, for sure. We also know that that countries react in a way that is never been coordinated in this pandemic. There's nothing that in this pandemic has ever been coordinated across the world. I mean, Africa has done well to have a coordinated joint strategy, but you can see that when people see these variants emerging, there's total individual countries react differently. And our recommendation and that of WHO is aligned, that restrictions do not really hurt. But again, I have to respect what individual countries do in interest of protecting their citizens. I think the first responsibility of every nation is to protect their citizens. Whether those measures are actually effective or not, I think as countries try to do that. Clearly, as I said in the introductory remarks, the South African leadership must be recognized and appreciated for the transparency, the timeliness of sharing this information. If everyone around the world was doing that, we would be at a very good place. I mean, a very, very good place. I think we need to give our hats to the government of South Africa. We also need to recognize the researchers in South Africa, Professor Tulio's group, and we have been working, as you know, in a network with them as part of the African CDC's Pathogen Genomic Institute. So I think that the reaction that what we need to do going forward is to have a coordinated approach for these variants, to managing the variants, because we know that there will be another variant. I mean, for sure. We also know that we will deal with this variant for sure. And there's a lot we don't know yet about the variant, and there's no need to panic. We just need to be patient and understand the variant. I know that we are not helpless. I think today, Paul, we are flooded with many more tools on the battlefield against this virus as a whole. It's still the same COVID. So, I mean, the same public health measures that we have been using for the last 2 years, especially in Africa, applies to this variant. We have vaccines out there, and that is a nice segue to the discussion, your second question about vaccines. Vaccines are beginning to flow on the continent in a very predictable and steady manner. We are all, like you, very concerned that countries are not picking up those vaccines. The uptake is not as we would have loved to see. We are on the drawing board, putting our heads together to see what can be done to galvanize that uptake. In the coming weeks, we will be summoning a meeting of all ministers of health so that we can come together, put our heads and minds and souls together and see what we can do to increase that uptake. So we are not indifferent to the situation. We see this as something that must be dealt with. I mean, I must say that we have to treat vaccinations in Africa as programs. Now, the acute phase of this pandemic is over, in my view. We have to look at vaccines as a program and then develop the right partnerships across the board and use the whole of society and whole of government to try to roll out these vaccines across the board. We truly don't have a choice. We have to use those vaccines there. So in the coming weeks, we will do our part. by using our convening ability to bring all ministers together and discuss and find a pathway. We'll also at that meeting be building more partnerships across the board so that we have a consolidated strategic approach on how to increase vaccination. With respect to Nigeria, it is very normal that the Nigeria CDC should be sequencing and sharing the information. And I think the work is just is huge out there to sequence the viruses there. So I believe Nigeria CDC will definitely be able to do some of the sequencing, but other centers like the center that Professor Christian Happy runs and others should be able to work in a network to support the work of Nigeria CDC, with Nigeria CDC doing its own part of the sequencing. So I don't know if this is a question that you asked with respect to Nigeria CDC.
No, the question is, if you look at the report from Nigeria, even though the news is there that Nigeria has reported Omicron, if you look at the GSAID genomic database, the sequence is not still available. And this is not consistent with how things were before with previous report from Nigeria, where the report is actually connected with the release of the sequencing. So I wanted to know whether is the conversion of the NCDC into this capability has actually limited the quality of genomic surveillance in the country, or from the perspective of the Africa CDC, looking at the way sequences have been coming out of Nigeria, is the pattern improving, or has this really been reduced to what used to be before?
So I think from, as you rightly said, the perspective of Africa CDC, and which countries organize differently, and I truly don't know how the internal structures within Nigeria are set up. But I would think that sequencing and releasing those sequences should be the natural functions of the Nigeria CDC, just as the US CDC, China CDC, and other CDCs of the world do. I mean, Africa CDC doesn't yet have laboratories, but in future, when they have laboratories, it is expected that the Africa CDC will be the custodian of those sequences across the continent and will share them appropriately there. So I think I'll leave that up to the internal mechanics within Nigeria, which I'm not really privileged to.
All right, thank you very much. Let's move on to take a question that's come through online. We have inquiries from both Coletta and Vinicius, who are asking a question that you've responded to, unless you have any additional comments, and that is about the message to countries that are banning travel from some African countries. But as I say, you've touched on that already. But Coletta goes on to then ask, with the advent of the Omicron variant and the developed countries rushing to use booster shots, where does that leave us as a continent? And on this continent, she states that we have not yet achieved herd immunity.
I think that's a very good question. As I said earlier, our vaccine situation is improving. That is, you continue to get regular supplies of vaccines across the continent now. We are not in the situation where we were 3 months ago. And I hope that by December ending and January, you even see more. So, which means the vaccine production pipeline is improving as well. And it doesn't need to be a zero-sum game where countries do boosters and then Africa doesn't have vaccines. So I think the production capacity is ramping up in the Western countries. Donations are also increasing from countries that have the vaccines. The United States has made some significant donations. You just heard the announcement from, I think, the Chinese. But let me just focus on what has been donated. Okay, yeah, that is going on the continent together with what Harvard is producing, is supplying. As I said earlier, Harvard has shipped out about 22 million doses of vaccines. If you convert that into the double doses, they represent 44 million doses of vaccines. So I think we are making progress there. The thing is that boosters, the question of boosters should be guided by science, by good science. So if you ask my views on the boosters, I'll say that in Africa, those people that are above 60 or so should be getting their boosters, because we clearly see that depending on the vaccine type, you get a reduction in the immune neutralizing antibodies after 6 months. And that correlates also to the severity of the disease. Those with underlying diseases, especially the immunocompromised individuals, should be having their boosters. But that is where I'll limit it. I would not recommend general boostering of younger people yet on the continent. But again, we'll see what the data says next year. So I think it's work in progress. We will continue to observe the science and use the science to drive the booster issue. But the key thing, which I count on all of us to do, is encourage countries, use your respective influences to enable our citizens to go out there and get their shots, because the vaccines are there. Some countries are actually delaying the delivery of their vaccines, including the deliveries from Harvard. So which tells me that the uptake is not as good as it should be. So we cannot blame it entirely on boosters. We should also be looking internally to say, what can we do to improve our own uptake of vaccines?
All right, thank you. Let's now say hello to Sophie Mukwena, calling from the SABC in South Africa. Good morning, Sophie. Or good afternoon.
Good morning. I just want to find out, in terms of the figures that Dr. John Nkengasong spoke about on rising cases, when you look at the death toll or fatalities,
Sorry, Sophie, your microphone was muted for a while. Can you just start again from the beginning?
The first question is, when you look at the number of cases, yes, we see an increase, particularly in South Africa and generally on the continent. But when you look at the death toll, there's a decrease. What could be the reason? Does it mean that this new variant might not be, or it is not as deadly as your Delta and your Beta? And we know that Delta is still the main variant that is in circulation around the world. And then the last question, the variant. I think for many people right now, the question is, how effective are the vaccines? Have you received some preliminary information in terms of the behavior of this new variant against the vaccines that we have now? Thank you.
Thank you so much, Sophie. There's very little we can make any conclusions for now with respect to the severity or the mortality related to the new variant. So epidemiologically, you first of all see the increase in number of cases, and then you begin to see the deaths follow, right? Because people don't just get infected and then they die. You get infected, then you may be sick for you get infected, you start with asymptomatic phases, you get to their symptoms, the severity of the symptoms, then you might recover or you die. So it takes time before you begin to see death rates catch up with the new cases. That is just typical of what you call the natural cause of an infection. So it is only in the course of the next 2 weeks or 3 weeks that we'll begin to see the number of deaths go up, if they do go up. If we go by what we have seen so far, just what we call anecdotal cases, the doctors in South Africa that described this initially saw patients that were coming down with very mild symptoms, itchy throats, not necessarily a cough, fatigue, mild symptoms. They didn't even hospitalize them. And they look around the South Africa, it was a very similar picture they were seeing. The case that was reported recently in just yesterday in I believe this was in California, from someone traveling from South Africa, had very mild symptoms and had been vaccinated as well. So it was a breakthrough infection. It's not unusual to have a breakthrough infection. I mean, we see that all the time, even with even with the Delta strain and and other variants. So we just don't know much about the clinical picture of that, but early signs from South Africa, these are what we call case studies from South Africa refer to mild symptoms, but we'll see in the next 2 weeks. So that is one. The second question is, would the vaccines be effective against these variants? For sure, I can as a virologist, I can say that the vaccines will be effective. The question will be, what is the level of effectiveness? And that would you be having a 100% effectiveness, or you have a decrease in effectiveness? Remember, these antibodies are very robust. They do many things for us. I mean, so in other words, they can blunt these variants, but we just don't know how effective, how high they will be for sure. We also remember that it is not just the antibodies that are protecting us. There's what you call the memory T cells. Okay, there are two arms of your immune system. One is your B cells that produce these antibodies, the so-called neutralizing antibodies that normally decrease with time because you are not seeing the virus all the time in your immune system. But then there's the T cells, which is they are the killers of those infected cells in your body. Infected cells with the virus, they just don't fade. They remain there for us for a very long time. So, in as much as we should be concerned with these variants, we will just need to wait for two things to happen in the coming weeks, and perhaps in the next week, at the end of next week or the week after, the answers will begin to be clear. So, two things will happen. Researchers will take blood samples from people that have been vaccinated with all kind of vaccines, all the vaccines that we have. They'll put that in the test tube, take the virus that they will grow, or they'll create an artificial virus, mix it with these blood samples, and see whether the blood samples from those individuals that have been vaccinated will neutralize the virus. That is the beginning of the understanding of that, because effectiveness studies, which is looking at the populations, how effective the vaccine is in the population, will take time. So the first thing we usually would do in the laboratory is to do what I just described. So that will teach us whether the vaccines are effective or not, and the answers can be made available in the next week or two. The second thing that will happen is that blood samples that have been taken from people that have been naturally infected but not vaccinated will do the same. They will take that blood, because blood has been collected across the world and stored in laboratories, and they will take that blood, mix it with the virus, and see how the virus behave in that scenario. So those two experiments, we hope that the results will be available in the next week or the next 2 weeks, and that will give us an idea of whether the current vaccines will be effective or not.
All right, thank you. I'm going to take another call.
We're coming out of that Africa CDC briefing, Director General John Nkengasong recognizing and congratulating South Africa on their transparency and capabilities on picking up the latest variant of coronavirus.